Welcome to Medicine with me, guys. It's your boy, Dr. Mario Guthrie, aka Mario Evan, and today we're going to talk about sex and Rona. Hey, drum roll, please. To make today's episode really simple, I decided that I'm just going to read something off my phone, forgive me, from the New York City Health Department, because it's really good. They released this on the 21st of March 2020, and they went through some guidelines for people in New York City as it relates to sex and coronavirus. All New Yorkers should stay home and minimize contact with others to reduce the spread of COVID-19. Fine. So they asked some questions. Can you have sex? Can you? Here are some tips for how to enjoy sex and to avoid spreading COVID-19. Know how COVID-19 is spread. Of course, it's droplet spread. So that means that you maintain a 6-foot distance normally. But it can spread through saliva and mucus, which means that if you're kissing somebody, you can give it to them. Give it to them, give it to them. Who's getting royalties for all of these plugs? We still have a lot to learn about COVID, but COVID-19 has been found in the feces of people who are infected with the virus. All right, so I'm not going to push this point too hard because you're still hearing droplet, 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 droplet. Yeah, it's droplet. We're wrapping it around droplet. Is it airborne? Not officially, they're still investigating it. They're saying that if you sneeze or something, the particles can stay in the air for a little bit before they fall. That's not technically airborne, that's just life. Particles, them going to be in the air for a little bit. That doesn't mean it's airborne. It just staying in the air a little bit. Anyway, these things are being checked out. But there's some studies that actually showed patients who had COVID and they were in their room. They did little surface swabs and stuff from the bathroom and stuff, and they found COVID-19 virus. What that means is that there's potentially fecal shedding. Potentially. Again, we have to be so careful. This is not giving you inaccurate information. How is it spread? Droplet spreads. Ma'am, droplet spread. Airborne, fecal spread. So based on that, the NYC Health Department has said that it has not yet been found in semen or vaginal fluids. And also, just to be clear, guys, mucous membranes are kind of those wet surfaces in your body. So like the eyes and have a kind of like a mucous membrane, but technically like in your nostrils and in your mouth. And I know you guys are smart, so you're going to be like, what about my urethra? What about my vagina? Yeah, those are kind of like mucous membranes too. But guess what? The mechanism for you getting a lung infection from something that you get in your eyes, nose, and mouth is totally different from getting something in your urethra, right? So as far as we know, you cannot get a chest infection from your urethra. You cannot get a chest infection from your vagina. All right? So any virus named COVID will go on down there, it's not going to infect your chest. What does that tell you now before I ask? All right, so back to it now. We know that other coronaviruses do not efficiently transmit through sex. All right, so traditionally coronaviruses are not sexually transmitted. Great. It's not in semen, it's not in vaginal fluids, but it is in saliva and potentially in feces. All right, so what you need to do is have sex with people close to you. Tip number 1, stick to your steady partner. Yeah. You are your safest sex partner, but before you even get to your steady sex partner, just have sex with yourself. I'm making this comedic, but the truth is masturbation is always safe because no one gets hurt. Masturbation will not spread COVID-19, especially if you wash your hands and your sex toys with soap and water for at least 20 seconds before and after sex. The next safest partner is somebody that you live with, assuming that them not stink out a road, because you know how some people stay already. Having close contact, including sex with only a small circle of people, helps prevent spreading COVID-19. I don't know how y'all interpreting this. I'm just reading this. You should avoid close contact, including sex with anyone outside of your household. And if you do have sex with others, have as few partners as possible. And if you usually meet your sex partners online or make a living by having sex, consider taking a break from in-person dates. Video dates, sexting, or chat rooms may be options for you. So you people would like to use Tinder and Grindr and Facebook and Instagram and however you meet the people them, or if you're a commercial sex worker, take a break. But really, a very important point to drive home though is even if you have a steady partner, keep in mind that if both of you are not on lockdown, socially isolating, socially distancing, and in a space where you're both home together, working from home, then it means that either one of you may go out into the workspace, go out into the environment, and potentially contract the virus and could bring it home. It does make having intimate relations a little bit tricky, because you always have to be self-assessing and navigating whether you or your partner is developing symptoms. So you always have to have this really keen awareness of self and of your body, and whether you're having a cough or a fever, so that you can actually protect the person who you're with all the time. But chances are, just like Idris Elba, if you get it, your partner probably gonna get it too. It's just what it is. Take care during sex. Kissing can easily pass COVID-19, so avoid kissing anyone who is not part of your small circle of close contacts. And I even like the small circle thing. Rimming, guys, which is mouth on anus, might spread COVID. Might, notice, because virus may be in the feces and it could enter your mouth. Right, so now notice the direction though, guys. Virus in the feces, entering the mouth. So the person would have to be infected, and it would be their feces that's infected, and you rim, and then in moving that to your mouth, you get it. I know you understand. Condoms and dental dams can reduce contact with saliva or feces, especially during oral or anal sex. Washing up before and after sex is more important than ever. Wash hands often with soap and water for at least 20 seconds. Guys, it's droplet spread. Sometimes this stuff can stay on surfaces. Bathe before, bathe after. Make sure you're clean. So if I came home from work and I potentially was in contact with it on something that I had, and I went and took a shower, at least the soap and water would wash it off of my skin, therefore decreasing the chances of me spreading it in a sexual encounter. Really good advice. I like it. Thank you, NYC Health Department. Wash sex toys with soap and warm water. Disinfect keyboards and touch screens that you share with others for video chat, for watching pornography, or anything else. 4. Skip sex if you or your partner is not feeling well, like obviously. And of course that would include all the symptoms I just mentioned: fever, cough, shortness of breath, respiratory symptoms, especially at a time like this. If you or your partner may have COVID-19, avoid sex, especially kissing. If you start to feel unwell, you may be about to develop symptoms of COVID, which include fever, cough, sore throat, shortness of breath, and you know there are many more. If you or your partner has a medical condition that can lead to a more severe COVID-19 presentation, this is so important, you may want to avoid sex. And these medical conditions include, as you know, lung disease, heart disease, diabetes, cancer, a weakened immune system, for example, having an unsuppressed HIV or a low CD4 count. Guys, this is really important. So for people who are younger, or if not younger, for people who don't have any underlying conditions, but your partner has an underlying condition, don't play with this. Because it's the same thing about being a carrier and bringing it home to your parents, you know. You want to be very careful about that, because you might be fine and have a mild disease, but the person that you're with may not. Be very careful with that. Last one, guys. Prevent HIV, other sexually transmitted infections, and unplanned pregnancy. And these are just your general sex tips that you need to stand by. For HIV, wear a condom to prevent it. Pre-exposure prophylaxis is available in the US. That would be PrEP. And having an undetectable viral load all help prevent HIV. Other STIs, condoms help to prevent. And pregnancy, make sure you have an effective birth control method on board for the coming weeks, especially if you don't want to get pregnant. That was a whole lot, guys. But to wrap it up in summary, I would say have sex with your steady partner. Always reassess the situation to make sure that neither of you have gotten the infection by being self-aware and checking your symptoms. Kissing, rimming, any mouth to anal stuff, be careful. Use protection, condoms, dental dams, stay on your medication, be aware, be sensitive, take showers before and after, wash your stuff, keep them clean. I think I've driven this point home, guys. For me, I'm gonna stay out of them streets. That's my advice to me. Until next time, guys, subscribe, comment. Let's have some conversations under these videos. Share it with your friends, with your families. If this one was too adult for you, then keep it to yourself. But real things we are talking about here. It's your boy, Dr. Mario Guthrie. This is Medicine with me. More videos to come, guys. Keep it locked.